So this is what everybody wants to know. This is the giant black hole of, well, what does happen when he comes in and you get in there and you do a comprehensive exam of what's going on in that mouth and you address what's going on in that mouth. To help me with this, I have Rocky. It's okay, I asked Rocky's mom. Rocky's allowed to star with us today. Rocky's a 7-year-old Yorkie Poodle mix. Rocky's a small breed dog. The small breed guys are more prone to coming up with some really fun things going on in their mouths because they've got teeth that are basically too big for their jaws. They are the Julia Roberts of the dog world. I don't often go through and see quite the same things with the Mastiffs, for instance. So Rocky is perfect for our purposes. Thank you, Rocky. Rocky had come in for an exam, and Rocky's mom had noticed that he was not as fresh as he used to smell before, and we'd seen a couple things that had us a little concerned, and we wanted to know if there was some stuff going on underneath there that maybe we should deal with before it turns into Dr. Bond's pictures. Thank you very much. So, in order to do this, as I said, I'm not going to do it on somebody who's wide awake. So, I'm going to go through and I'm going to give him some sedation. This is a little deeper than the twilight that they go through and they use on some of us who are uttering complete weenies, but it's not quite as deep as, for instance, Dr. Xrays would use when he's doing an orthopedic surgery. This is going to be deep enough that I can go in there and look at what's going on, and I can probe and see what's going on, and I can make funny buzzing noises without scaring the you-know-whats out of Rocky. In order to do that, we need to place an IV catheter. This is partially for protection so that if anything interesting comes up, there's a direct line for any medications I have to give him. It's also the direct line for good old propofol, thank you. We administer a light anesthesia. Our technicians are sitting there hanging on to Rocky. Rocky is staring at Desiree. Desiree is giving Rocky the good stuff. Given enough all of that, Rocky is now down for the count. Rocky thinks he's had about 5 beers. This is when we go through and we're going to do some things to protect Rocky before we so much as look in that mouth. We're going to place a tube to protect his airway. This is to make sure that when we're cleaning everything, when they're probing, when we're getting all kinds of nasty pieces of rock off of these teeth, that none of that goes down his airway. You do not want loose teeth down your trachea. It's not a good thing, folks. You also don't want all that nasty saliva-filled fluid going down there either, because contrary to the old wives' tales, dogs' mouths are not sterile. We're also going to do a lot of things for monitoring and for protection. This is the thermometer. We all know where the thermometer goes at the vets. We're going to monitor his temperature and make sure he doesn't get too cold, because if you stay nice and warm, you're healthier, your blood pressure stays better, and you recover much more quickly. We're also going to go through and put a little bit of lube in his eyes so he doesn't get dry eye, because that's no fun either. We're then going to go through and we're going to attach a pulse oximeter. We're going to measure his oxygen. We're going to make sure that his pulse rate is going well, his rhythm's going well, he's got plenty of oxygen going on in there, and he's lovely and healthy. These are EKG leads. This is telling me that electrically he's lovely and healthy while he's getting his sedation. We're also going to go through and attach blood pressure monitors so that we can make sure that there's enough blood pressure that it keeps his kidneys lovely and healthy underneath all of this. Fortunately, I don't have to do all of this myself. I have my surgical monitor. This is a wonderful chance when he is several beers down and not noticing what I'm doing to get in there and trim his nails really, really well. This is the one time nobody's going to go through and wiggle for me, and clean his ears as well in there. So nobody ever complains for this portion. There is no substitute for a human monitor. I don't care how many thousands of dollars your monitor costs. There is no substitute for somebody watching your patient. Thank you, Desiree. Thank you, Rocky. We're going to go through and keep him warm and dry. We are using water. Water is cold. We do not want Rocky to be cold. So we have him on this lovely protective mat, nice and warm. We then have layers of towels over the top here. We have heating pads over the towels, more towels over the heating pads, and I swear Rocky's in there. This is when we're going through and we're putting on our gloves and we're starting to take a look at what's in there. So, what's in there? We're going to be taking a look at every tooth in this face and documenting everything we find in there. This is a comprehensive oral health exam. We're looking at every tooth in every dog we're looking at every side of every tooth. We're also monitoring what's going on with the sedation and making sure all of his vital signs are looking good. This is where we're marking any teeth that are loose, any teeth that have heavy tartar, any teeth that have a lot of gum recession, where perhaps the tartar is the only thing holding that particular tooth in there. Any teeth that have furcations, which is areas where you've got sections of the root exposed and you can go from one side of the tooth to the other through the wrong direction. What's supposed to be in there? How many teeth does a dog have? How many teeth does a cat have? How many of us knew that before looking at the slide? You don't have to answer that. One half of a dog looks like this. Your smiling, flea-nibbling teeth, you're picking up the tennis ball teeth, the small, now we're going to pick up our food teeth, the I'm working hard teeth, and certain of those teeth are going to be more prone to have more problems than others. Just because I want to be fair, cats have teeth too. Cats have fewer teeth than dogs, but they sure do know how to use them, thank you. Take a particularly hard look at this model and look at how big these tooth roots are. Think about the forces that dogs can exert when they are chewing on things, especially after they've chewed something you like. These roots are sometimes taller than the crown of the tooth itself. What you see is nothing near the full size of this tooth. So, when we have a problem, when we have an abscess way the heck down here, we're not just taking a tiny, cute little tooth out. That's a lot of work. We're going to get in there, and the first thing that we're going to do is clean and evaluate. This doesn't look all that bad. This is rocking. But look at how we're starting to get some root exposure here. Look at how we've got some redness along the gum margin. Look at how this whole gum margin is pushed back up this way. Doesn't look all that bad in here, does it? Remember that. You're going to need it later. Little bit of gingivitis in here, not too bad. Little bit of tartar, naughty, naughty boy. Not bad up here. A lot of stain down here, not otherwise awful. The first thing we're going to do is get the tartar out of the way. I can't see through tartar, can you? So let's get all that junk out of there. We're going to use an ultrasonic scaler just like your own dental hygienist does. That makes noise, that buzzes. Dogs don't like that, that's why he's sleeping. That also makes a lot of wetness, that's why he's wrapped with things keeping him dry. The next thing you're going to go through is check for damage around the roots. This is the famous dental probe that your dental hygienist also goes through and uses. We're going to check for pocketing. We're going to check for damage to where that tooth is held into your jaw by the ligament. We're going to check for anything that looks like it's got a rough surface, like maybe you've gone through and chopped a slab of tooth off the top there. If we go through and we find something unusual going on, we're going to take X-rays. How many of you think that I can take an awake dog, shove a piece of X-ray film in his face, make a funny buzzing noise followed by a click, and say, okay, now let's get this X-ray back from you? Yeah, right. So, this is again why he's sedated. We take the films, we use the same X-ray that your own dentist does, we go through and find what's going on. This is just for anybody where we find something going on. If you are pristine, I'm not as worried about this one. We're going to polish away the stain. We want you to start out with lovely, stain-free, flat, no rough surface teeth. Why do we care about that? Because rough surface is where the plaque is going to attach first, and where plaque goes and where saliva goes, that's where you're going to end up with tartar. If we can give you a lovely smooth surface, it's harder for all this stuff to attach, it's easier to brush, and it's going to be a lot longer before you're going to see some of these changes that we don't want to see. Here we're going through using the polisher. We don't worry as much about cute flavors of polish. Now we're going through and just checking all the surfaces in here. This is how Rocky looks afterwards. Hey, that looks great, doesn't it? It's time to send him home, right? If everything is perfect, we'll then go through, follow up with some fluoride, just to again take good care of the tooth surface, the enamel surface, and then he'd be ready to go home. But, Dr. Levie, this is a presentation. You're not talking about healthy teeth. You're talking about teeth with problems. What happens if I find a problem? What happens if I find what Dr. Bond was talking about, and I find some pretty advanced periodontal disease? Oops, there's some pretty deep pockets around these teeth. If you've lost more than half of the amount of root that holds your tooth into your jaw, that's a problem. That's when we start talking about, can we save this tooth? Or would we be better off getting rid of this tooth that's surrounded by all this junk down in this pocket that you cannot brush away no matter how good you are and how big your toothbrush is? Let's get this out of there so that you don't have to deal with lots and lots of infection that is going to go through and potentially affect all the teeth in a row. Look also, oops, We've got some loss of bone around that big guy too. This did not look all that obvious from the outside. Oops. Let's take a look down here too. This is a lower jaw. That previous one was an upper jaw. Whoops. Here's a nice big pocket where all that junk from the mouth can hang out together with all that bacteria from the mouth. This one, you've only lost about 40 to 50%. We might be able to hold on to this guy. But these are the kinds of things that we're finding that you cannot see from the outside, no matter how good you are. If we can go through and if we think that we can save this tooth, if this is an important tooth that's worth saving, the picking up the tennis ball tooth and the I'm chewing all my dinner tooth, then we might go through and we might use a leave-in antibiotic called doxorubicin to try to get rid of all the bacterial crud that's down in there and see if we can save that tooth. Sometimes we can save it, sometimes we can't. If we can't save it, you're better off with the tooth out of there and not serving as a chronic focus of infection. Equipment setup. Ooh, scary, lots of metal, sharp things. Ooh, I'm not big on being the victim in the dentist thing. All this is a bunch of things for loosening up teeth that are bad and for closing up things when we're done, because you cannot tell a dog to swish and spit. When we need to go through and take out a tooth that has more than one root, remember several of them did, we might use these high-speed hand pieces to cut the tooth so that there's a piece of tooth attached to every root, and then it's much easier to get it out of there without breaking roots and without doing more damage to a jaw than you really want to. We use local anesthesia because we are nice people. This is basically doggy Novocaine. We do this ahead of time so that when we go through and take these things out, these guys don't have to go through and hurt. Hi, G. Nice try. The first thing we're going to do is loosen the shallow attachments around these bad teeth. By the way, this guy's going and these three little guys are going, so pay attention to where we are. We're going to loosen the shallow attachments, make everything in here so that we can get our equipment in there. We're then going to take what are called winged elevators. They look like half a straw. Go in there and oh so very gently loosen up those ligaments that are holding the tooth into your jaw. Then when it's nice and loose and floppy, just gently pull it out. When you've got a multi-rooted tooth, you do have to go through and separate it. Okay, can't see it quite so well. We're just taking a little drill and cutting it so that it's easier and safer and more peaceful to get out. Get all the bad roots out of there. Now we've got holes in the head. Let's close them. Let's go in there, let's flush them out with some chlorhexidine so that we don't have infection, and let's close that. Dogs don't swish and spit. We're going to go in there, we've got a nice flap of tissue, we're going to take some absorbable suture material, we're going to close it up. If you didn't know there were teeth here, you'd never guess it. Dr. Draper did a beautiful job in there. We're also going to go through and monitor the guy during recovery. We monitor you going down, we monitor you coming up. When you are dancing, barking, and flirting with all of my technicians, then you're ready to go home. What else are we looking for in there? I mean, since you're in there anyway, we're going to be looking for things like retained baby teeth. This guy's got a full shark mouth. Check it out. All your baby teeth, all your adult teeth. Oh, check it out. Let's keep some spares. That's not a good thing. That's usually the smaller breed dogs who are the least able to handle too many teeth jammed into a tiny little face. They start out looking like this. Check out what they look like by a couple of years old. It then gets worse from there. We also look for worn teeth. If any of you have dogs who particularly like playing with tennis balls, my favorite way to wear down your teeth. It's great, you can't bite me. But look how flat these get. Look how you get exposure of some of the inner tissues of the tooth there. If you go through and expose the wrong place and some of the bacteria can get in there, they can go follow that tooth root all the way down there and give you a nice abscess. Let's not do that. So that is demystifying what happens when you come in and you hang out with me for the day. We find out what's going on, we correct what's going on, and we send you home happy, cheerful, flirting. And the next one up is going to be Dr. Hinze.